This new Medicare audit is just breathtaking. The government auditors way back like years ago, they had asked a Blue Cross Medicare Advantage health plan in Minnesota to turn over medical records of patients who'd been treated by a doctor who was, they believed was fraudulent. Blue Cross said they couldn't find the records. This was in 2016. Now a review of 90 government audits released to Kaiser Health News in response to a Freedom of Information Act shows that health insurers, I'm quoting from this report by Fred Shute and Holly Hacker over at Kaiser Health News, reveals that health insurers that issue Medicare Advantage plans have repeatedly tried to sidestep regulations requiring them to document medical conditions the government paid them to treat. Now, in other words, they're ripping us off, these Medicare Advantage plans. They say auditors uncovered millions of dollars in improper payments, citing overcharges of more than $1,000 per patient per year by nearly 24 health plans. Now, if you've got, 1 million people and you can get $1,000, a year per person that you can charge the government that you don't have to pay out in payments because you're lying to the government about how sick that person is, that's, what is it, 1,000 times a million? That's $1 billion, isn't it? Or is that 10 billion? I can't, again, I'm terrible with math like that in my head. That's a hell of a lot of money. Let's just leave it at that. And oddly enough, Chuck Grassley of Iowa said, we need aggressive oversight to recover these overpayments. Only about 5% of Medicare Advantage plans are audited, so these companies have a huge incentive to rip us off, or to rip off our government, to rip off the Medicare Trust Fund, which is going to kill Medicare if they keep doing it. And even when they are busted, executives never go to jail. No executive has ever gone to jail for Medicare Advantage fraud, even though these companies are committing fraud left and right against you and me, against the government. The rate of invalid codes, again, quoting from this piece by Kaiser Health News, the rate of invalid codes, in other words, they're saying, okay, you have a far more serious disease than you actually have, right? The rate of invalid codes topped 80% at Touchstone Health, a defunct New York HMO. The average that they were finding was that these companies are overbilling the government about $1,000 per person per year. This company was overbilling $5,888 per person per year. They took the money, they paid their executives huge amounts of cash, and then they bankrupted the company when it looked like maybe their fraud was going to get busted. Other Medicare Advantage plans argued that they had no luck retrieving out of old Medicare records. We just can't find them. Dave Corrigan, who is a deputy administrator at CMS, said that, quote, as a general matter, Medicare Advantage audits are not designed to detect fraud, nor are they intended to identify all improper diagnoses submissions. Well, then why the hell do we call them audits? The cost to taxpayers, Kaiser Health is estimating at 11 of fraud within the Medicare Advantage system. And this is direct theft from our federal government by these for-profit corporations. Kaiser Health is estimating this year, 2022, at $11.4 billion. Senator Sherrod Brown says this is not a partisan issue. It is, sadly it is.